Now we're transitioning into our first panel of the day, which will highlight discussion amongst a few of our members of the Fight for Five working group. I'm very, very proud of this group. We've been working together for the past few months to really push our Fight for Five campaign forward. And this session will include a discussion amongst a few members of this group on why having a network of support in diabetes advocacy is vital and empowering. So I wanted to introduce you first to Maham, our Fight for Five working group co-lead, and she'll be kicking off the discussion today. Take it away, Maham.
Thank you so much, Faith. It's a pleasure to be here with you all today. I'm Maham, and I'm the co-lead for the Fight for Five project with T1 International. In the Fight for Five working group, we all share a common goal: to ensure that insulin and blood glucose testing supplies cost no more than 5% of the average salary in any country. At the moment, we're focusing on Pakistan, which is where I'm from, India, which is being represented in the working group by Pramita, as well as Zimbabwe, represented by Tino, and Panama, represented by Rosa. I'll be talking more about the project soon. I'll be facilitating our Fight for Five working group discussion today, where we'll be talking about the importance of community and why having a network of support in diabetes advocacy is vital and empowering, and how T1 International has provided that for all of us. Pramita, I want to ask you first, what is the power of community in advocacy?
Sure. Thank you so much, Maham. So I would like to start by saying that today we're on this panel not because we're professionals. For instance, I'm a law student, Rosa is a lawyer, you're a doctor yourself. We're on this panel not because of our professions, but by the virtue of the fact that we're patients. When I was diagnosed, I was 12 years old, and I used to feel so lonely, and I didn't even realize how pricey the insulin was until I got older. And for a long time, I used to feel the sense of loneliness, like that I had to suffer by myself and that I was a financial burden on my family, etc. But as I interacted with the community, the whole diabetes community, be it by social media or the advocacy campaigns, I realized that what I was experiencing was not my personal struggle. That was a collective struggle. That's a structural oppression that's happening in all of us. I think the power of the community helps you to realize that you're not the problem. The problem is at a larger level. It's a systematic issue that we need to address. What do you think about community advocacy, Rosa?
Thank you, Pramita. I'm not a patient myself, but I'm a mother of a teenager with type 1 diabetes. It hasn't been easy for us this last year, but finding a community here in my country, Panama, has helped us a lot to feel understood and gave us the tools to overcome obstacles. Just like Pramita said, you don't need to be a professional to be an advocate. You just need to feel the passion for this. As a mom, and as a lawyer, it's really important for me to fight for my son's rights. But at this point, it's also important to get him involved in the advocacy. He's young, but it's important to empower people with diabetes, and especially the younger generation. I can never understand the feeling of having diabetes, but it's important for the patient to be at the forefront. I always said, my son, it's okay, don't worry, it doesn't hurt when he's using his insulin. But he still gets upset, of course, because he's the one that feels the needle enter his body. He's the one that experienced the headaches, the uncomfortable feeling of being hypo. And many, many times during this last year, I wanted to be the one that need the insulin. And that feeling is the is the thing that drives me to fight for him and for those that are invisible to the system. Tino, what about you? Tell us, what do you think about the importance of community when advocating?
Well, thank you so much, Rosa. Great. And I concur greatly with both of you, Rosa and Pramita. So great. Thank you so much. I think I'll just have to add on what you've said on what the community means to me. So basically, I say community is just a group of individuals who identify, like all of us today, who identify as having a common context, experience of living with a disease, or experience of working with a disease, or a duty to care for people who have experienced the disease, which I believe I'm blessed with, because I believe that we are stronger together. So the power of a community is something that should be reckoned with. Why do I say that? Because it is everything. Maybe something that we should be grateful for, something that we are grateful for after the diagnosis of diabetes. And I quote, as the DDoC voices usually say, find your tribe and love them hard. And I hope that there's someone here who would be able to concur with me and agree to say, wow, this is something that we usually say, because there's no judgment in a community. There's encouragement. We are not alone, that we can lead our healthier lives regardless of our geographical locations, because we have all challenges that might be different, but we are in this together, right? So like I also find motivation to do better, to improve my care on our individual communities by learning from others who have walked the walk, or who have talked the talk, right? So also I find inspiration from the empowered communities, and we use those as benchmarks by getting acquainted with the history, or to learn how these people, they have managed to change the narrative within their own communities. So, and further, I think that the power of a community found like the opportunities that the community provides to the people that are involved in it, and to those that might want to be part of it. And with all being said, I would have to hand it back to Maham. Thank you so much for the question, Rosa.
Thank you so much, Tino, Pramita, and Rosa. I'm always so inspired to work alongside you. Your stories are so powerful, and having you all as part of my community at T1 International is part of what keeps me motivated to continue advocating even when it feels impossible. I've personally been diagnosed with type 1 diabetes for 17 years, but I've only been involved in advocacy for 2 years, and I wish I had gotten involved much sooner. I felt such a positive change within myself because the power of community is so strong. Having this community makes me feel like I'm not alone in my struggles, and it motivates me as a medical doctor to serve the community and patients better. I honestly didn't even know that I had this drive in myself to fight for insulin for all. I actually have another question for you all. We've heard why community is so important to you. But what role has T1 International played in your advocacy journey? I'll go to Tino first.
Thank you so much, for this. This is great, really, because I myself, as a person who got diagnosed in 2010, I jumped into advocacy in 2020. So why do I say T1 International has been important in my advocacy journey? So T1 International has been amazing and a blessing in my advocacy journey since 2020, when I became a digital advocate. So I realized that I could start engaging within the international community as a patient advocate, and T1 International was the first organization that I reached out to learn how I could better myself, or to be a greater voice of being like to a greater service to my community, because I believed their approach was exquisite for me to be part of it, and to help me amplify my tiny voice, which I believe is growing, or has grown to some people who say that, right? So a huge thanks to the T1, to the entire T1 International team, even for those who are no longer part of it, but I'm so grateful to them. I wish I had much time to mention their names, because they meant so much to me. And I'm grateful to be part of this great networking, to the great networking T1 International has provided for me to collaborate with others, advocates from around the world, like you all, right? So, and thus I give T1 International her flowers for getting me involved and getting me engaged in advocacy, for my rights and for the rights of other people who are also impacted like myself. So I would say long live to every advocate out there. And I quote the World Health Organization, this is what they say: it is important to allow participants to self-declare themselves as members of a community and not to assume that individuals are part of a community just because they have similar traits of experience. So this is what I believe T1 International has been for me, because they greatly concur with the WHO, what they've said. And with all being said, I would have to say, I think maybe I would have to pass it on to Rosa to hear from your perspective. Over to you, Rosa.
Your experience, Tino, was really powerful. Thanks for sharing with us. For me, I would say that being part of T1 International help us to understand, help us all to understand that we are not alone, that the issues that we are facing here in my country, Panama, are the same all over the world. T1 International assembled a big puzzle. And those pieces are our countries that are seeking the same goal, the same purpose, that is to fight for insulin for all. That's what I believe. What about you, Pramita? What role has T1 International played in your advocacy journey?
Yeah, thank you so much, Rosa. I think I totally agree with you both. I think from my side, I would like to add that I think T1 International provides a platform where various communities can come together. So there are different issues that people with diabetes are facing all around the globe. One being affordability, the other being accessibility, then stigma, and maybe some countries, all of them. But what T1 International does is that we're able to, here and come together in solidarity, validate each other, share our thoughts. And sometimes it's so amazing to hear the success stories of other countries. So I think it provides a platform for support, for us to gain perspectives together as to how to bring change in our particular countries. So in total, T1 International, even though all of the countries may have different problems, we all have a same goal, that is insulin for all, rights of people with diabetes, and that being a human right. We all are individuals with a common goal in mind. What do you think about this, Maham?
Thank you, Pramita. T1 International has helped me realize that diabetes is not just a chapter in my medical book. In fact, advocacy has the power to change things. It unites people with the same condition, regardless of sex, race, color, language, religion, and social standing. As I mentioned before, myself, Tino, Rosa, and Pramita are working together on the Fight for Five project, with the goal that the out-of-pocket cost of insulin and blood glucose testing supplies represents no more than 5% of the average income in any given country. The Fight for Five working group is implementing both high-level and local, country-level advocacy to create policy change and pressurize Big Pharma to reduce the prices of insulin. Right now, people in Pakistan are spending 47% of the average income on insulin and testing supplies. I'll hand over to Rosa.
Sorry. People here in Panama are spending 25% of the average income on the insulin and testing supplies they need to survive. And for sure, we need to change that. Tino?
Oh, okay, great. So this is just, the numbers are absurd, the statistics are absurd. So like I would say, people in Zimbabwe, my country, where I am from, are spending about 87% of their monthly average income on insulin and testing supplies so that they can survive. So this is the narrative that I hope that everybody, if we do get involved together, we can change it. And maybe we would need to hear also from Pramita about the status quo in India. Over to you, Pramita.
Yeah, totally. People in my country, India, the situation is so unique. There are income disparities, and on an average, people are spending, the lower class, the lower middle class and middle class, they're on an average, they're spending 81% of their average income on insulin and testing supplies that they need to survive. Let's just remind ourselves that this is not getting, from by spending this amount on health is not getting better. We need it to survive. It's like water. And 81%, 87%, these are such huge numbers. We definitely need to change that. I'll hand over to Maham to explain her situation.
Thank you, Pramita. We clearly have a long way to go to our goal of 5%, but we will reach our goals much faster if we have your support. Please do join us as we fight for 5. You can find more information on how to get involved on our website at T1International.com, Fight for 5. Does anyone have any questions for our Fight for 5 working group? Please ask your questions in the chat. Tino, how is the situation of accessibility in Zimbabwe in the rural areas?
Thank you. I think that's a question. It's a bit difficult question, but I'll answer to the best of my knowledge with the situation that is in the rural areas. Yes, like mostly we say less remote areas. These are the people that are usually found wanting. And I would say maybe in the puzzle, they are the ones that we say they are always last to be recognized in anything, because sometimes even if they do not have access to the insulin that they need or any diabetes supplies that they might need present to them, they'll have to embark on journeys that are just absurd, like 200 kilometers. Imagine traveling for 200 kilometers just to get access to one vial of insulin that will maybe last you for 3 weeks. That is not so good, because things are not the same in terms of what is happening in the urban areas and what is happening in the rural areas. And mostly that's where we find most people, they ration their insulin, and some of them are still using those traditional insulin that were used back in the days. If I'm starting to mention, might not be able to recognize any of them. So people in the rural areas, so that maybe to recognize that they need recognition and they need to be considered more than what we see. The things are not really stable. So I think this is the situation, and which I hope would change with our continued advocacy. Thank you so much. Maham.
Thank you, Tino. Rosa, since you're a caregiver and don't have diabetes yourself, how did you get involved in advocacy?
Okay, a year ago, when my son was diagnosed, we need someone to help us to understand what diabetes was, to be able to guide him and to educate him. Diabetes is a stigma in our countries, and it's really popular thought that diabetes is just a product from bad eating habits and the lack of exercise. And this is how I found in my country the only organization that has a duty to educate in Taiwan. So be able to give back to the community some of what we receive. I was involved as a volunteer. So, as a lawyer, so one thing leads to another. And now I dedicate a lot of my time seeking policy changes and implementing law regarding diabetes. Long story short. Thank you.
Thank you, Rosa. We're so glad to have you on our team. Pramita, if there are policymakers listening to this right now, what would you tell them? What needs to change?
All right. So as I've already mentioned, the situation in India is quite unique. It has its own challenges, and the statistics of insulin spending are absolutely absurd. So if policymakers would be listening, I would suggest that, the approach should be twofold. First of all, we need to bring a cap on the insulin level. There's already, in India, there's national list of essential medicines included. However, we need to include all types of insulin in that list and bring a cap, so that even the middle class or the rich people, whatever, they're able to have they have to pay a reasonable price. However, since the situation in India is unique because of huge income disparities, we need to ensure that even those who are falling below poverty line or are generally poor, they are getting subsidized insulin at all government hospitals. All government hospitals, or even all hospitals, it should be free for them because it's a need, it's a right. Otherwise, people would die. So this can't be termed as excessive, of course. So I think it's a very reasonable need. And then secondly, what I think is that in terms of advocacy as well, the we would suggest the policymakers to raise awareness programs about people living with type 1 diabetes. See, the thing is, it's a human rights issue. It's not just an issue of type 1 community, it's a human rights, larger issue. So everyone should know the consequences of not being able to have enough insulin. Imagine 1 out of 4 people dying because of rationing insulin. It's a torturous death. It's a blatant human right violation. So everyone should be aware of the same. In an era where we're still thinking that, diabetes is caused by eating excess sugar, when we have stereotypes like this, we need to change that. We need to address the real situation, the price of the insulin, not talk about exercise or fitness anymore. I'm not saying that do not talk about it at all, but then this is important. Insulin is needed for survival, and see the situation right now. So this is necessary for a consciousness building. So I think these 3 steps would be immensely powerful, and we would like them to be integrated. 1 being the cap on insulin levels, 2nd being subsidization, and 3rd being consciousness and awareness. So that is what I would suggest.
Thank you so much, Pramita. I'll hand over to Faith now. Thank you, everyone.
Thank you so much, Maham, Pramita, Rosa, and Tino. What a great discussion. It's been amazing working with you all on the Fight for 5 project. And it's true that community has been extremely important in this process. And I'm so grateful for all of you, as well as our members of the Fight for 5 working group that aren't speaking today as well. We have a really long way to go until everyone is able to access affordable insulin, but we're slowly making progress, and I know that we're going to get there one day. If you'd like to join our Fight for 5 and to receive updates on our progress towards our ambitious goals, please visit T1International.com/fight-for-5 and sign on.